In our interview segment, I had a conversation with Professor Adewole, the Minister of Health, on the nation's healthcare system. He talks about the achievements in the last 3 years and how the government is resolving the issue of resident doctors. Professor Adewole, welcome to the program.
Thank you so much, Gloria.
Well, let's begin with your office. I mean, you have been here 3 years now. Yeah. What would you say you have achieved so far? Are you satisfied?
We've been 3 years plus in this office, and it's been a remarkable 3-year period for us in the health sector. Packed full of achievements, and we really want to thank Mr. President for giving us an enabling environment. We started first by trying to create the enabling environment, changing perspective of people about the health sector, putting in place a national health policy, the third in the history of the country, and this was done in 2016. The national health policy actually set the pace for whatever we wanted to do. We also, working with stakeholders, developed an ambitious plan to restructure and reform the health system in Nigeria. We quite early agreed to achieve and set ourselves on the path to achieving universal coverage. We had 4 signature projects. We wanted to address the issue of maternal and child health in Nigeria. We wanted to address the issue of mother-to-child transmission of HIV. We wanted to address public health emergencies, and we also wanted to address the issue of cancer challenge in Nigeria. And so far, for all the 4, it's been a huge success story.
Would you say, on the issue of resident doctors, that has been a lingering issue for quite some time right now? And then we're wondering, you have been a former president of resident doctors.
And a live member of the National Association of Resident Doctors.
Fine. So how come we are unable to resolve this issue, the issue of strikes?
I must commend the leadership of the resident doctors. In the last 2 years, strike has not really been an issue with resident doctors. No. We are striking in 2016. I cannot recollect having a strike by resident doctors, NAD, in 2017 and 2018. So they've been very cooperative, and having been one of them, I think we speak the same language and quite seriously understand all the challenges, and I think up to now, we have a very good relationship with resident doctors.
What has been the issue? I understand, and everyone has seen that there have been, disenchantments, pockets of grievances here and there. Tell us exactly what the issues are.
Well, maybe you know the issues, and you need to tell me. As the minister, there are no issues. There are pockets of grievances here and there, which we're prepared to address. For the first time, Mr. President gave assent to the bill on residency training program, the first in the history of this country. But unfortunately, we cannot have a perfect legislation. That legislation prescribed a period of training for resident doctors, a maximum of 7 years. Some residents are not too comfortable with the 7 years bar, and I said, look, we just must work with something. So we are looking into some, what I would call petty grievances, minor issues, and this will address. And I think they're happy with that. Is there
a perfect arrangement on the issue of welfare?
What exactly do you mean by perfect arrangement? There's no perfect system anywhere in the world. None. I want to see health workers well paid, and we're not there yet. I want to see health workers well remunerated. I want to see the issue of welfare well addressed so that people are satisfied. When we give them more, we will demand for more from them.
They have a lot of issues right now. Did you speak with them one-on-one to address any of these problems?
I had a discussion with the president of NAD as far back as Saturday. So I'm in touch with resident doctors.
You were quoted as saying earlier that Nigeria has the ratio of 1 doctor to over 4,000 patients. And I mean, you also say that that is very okay for us compared to other African countries.
Correct.
But we have doctors already, leaving the country and, so to speak, brain drain. Would you say we're heading in the right direction with this sort of arrangement?
Well, I would love to see a situation where we'll keep all our doctors in Nigeria. But that is also not good for us. We need to lose some, we need to gain some. But it would be unhealthy for Nigeria to lose a large number of doctors to any developed country. So we need to work against it. And let me also tell you, that Mr. President has set up a committee being handled by the National Security Advisor to let people know that we consider it to be a serious issue. We do not want to lose a large chunk of our medical practitioners because we need them home. So we're working hard on this. We're creating an enabling environment. We're working with states, appealing to them to absorb more of the doctors. We're working on a reform of the health system. We're looking at a system modernization program, and we're building new facilities so that we can absorb some of these doctors. There are critical issues. One, where do we put them? We also want to engage them even outside Abuja and Lagos, where about 70% of our doctors are located. Because Abuja and Lagos are just two cities in Nigeria. We have more. And so we want to see doctors in other places. So I think there is an ongoing discussion, and it's not something that we can solve overnight, the problem of maldistribution. What I said at the level meeting was that we must not paint it as if there is complete absence or near absence of doctors in Nigeria. We are not where we want to be. We want to be in we want to have a situation where there will be doctors all over, manning our facilities, well-trained people. That's the ultimate goal, and we love to be there one day.
It's one thing to actually paint where we want to be, and where we are now, you know, it's a far cry from where we ought to be. And so I'm wondering, how much support are you getting from the states?
Which states? State as of federal, or state as of real state?
From the state governments. Well,
there is a committee chaired by the Vice President on Human Capital Development, and this essentially is looking at human resources for health. And Governor Rufai actually represented the states, and there are robust discussions going on between us and the states. And we're also engaging the Governors Forum to see how we can bring the states on board. We're even advocating for more resources to the states to really use in modernizing the health system at the states. When you look at the health system, the primary care system is the foundation. The walls represent the secondary care system. The roof is the tertiary. And what we are doing as a government is to say we must really be pragmatic. We cannot have a beautiful roof made of gold where the foundation is unsound, where the walls are collapsing. So that's why we must engage the states, and I think it is happening.
The President, during 2015 campaigns, promised to, in his words, to revive local production of vaccines in Nigeria.
Oh, and he has done that. The first time in the history of this country. For 12 years, so previous governments could never achieve this. Mr. President, sitting and presiding over a Federal Executive Council, approved a memo from us on domestic production of vaccines, the first time in the history of this country.
And how far have we gone on that?
Oh, they're working. We've set up a company. They've developed a blueprint. They have a work plan. And we met with them about 2 weeks ago. Unfortunately, there are international challenges, which we must also factor in. Immediately, FEC gave the approval. Gavi also extended our transition period from 5 to 10 years. And that has implications for production of vaccines. But we are looking into this in its entirety. But I can tell you, the approval of the memo, the constitution of the governing board, development of a working document are positive attributes of this administration. And we must give kudos to Mr. President.
Well, Professor Isaac Adewole, thank you very much for your time.
Thank you, Gloria.
Abuja. Thank you.
Thank you.
Well, thank you for your mails and tweets as always. Keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything within your locality. Don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Umezuke. See you again.